my talk is on tennis elbow. I have tried this again and again. I have not referred the patient many a time to physiotherapists because this is effective, not that I am against what they are doing. So basically, it is weakness of the extensor carpi radialis brevis. Pain in the lateral epicondyle of the humerus, you all know. Not able to lift even small objects. You give a book in your clinic, the patient will get pain. So it's not necessary that they have to lift heavy objects. Pain keeps on coming all the time. Housewives are often the patients who are affected by it. Failure of NSAIDs. You give diclofenac, you give aceclofenac, you give lornoxicam, you give piroxicam, nothing because it is not inflammatory. It is weakness of the extensor carpi radialis brevis muscle. Elbow belts. Some people are coming 1 month, 2 months, 3 months, elbow belts. Nothing is going to happen. Physiotherapy modalities, they are giving lots of physiotherapy modalities, Mr. Nowadays. This, that, TENS, this, that. But basically, you have to develop the strength in the extensor carpi radialis brevis muscle. I have done it several times, and probably I don't know how many years back I must have given a depometrol or a Premaxo injection over there. I have not given. Ice manipulation, TENS, acupuncture, nothing is going to help unless the patient develops the extensor carpi radialis brevis muscle. So you have this pain and tenderness in the extensor carpi radialis brevis over there, over the lateral epicondyle. And this is the muscle over here. This is the brachioradialis. This is the extensor carpi radialis longus, and this is the extensor carpi radialis brevis. This is the deuterum and the extensor carpi ulnaris. So this is the muscle which is weak, and I give only TheraBand for the patient. I have never had a patient coming back with tennis elbow, and the patient who comes with tenderness over here, once he does it in my clinic, I have TheraBand with me, but now I have a physio also. The pain as he walks out is not there. This is the magic of TheraBand. So how I do it, I'll show you. You have the Cosen sign, that is pronation, and blocked dorsiflexion, the patient gets pain. So basically it's weakness, as I said, of the extensor carpi radialis brevis. Strengthen the muscle by static TheraBand exercises, 20 each, 2 times a day. The patient, and I can promise you that, will leave your clinic without or with much reduced pain. That means it is going to be effective. But the TheraBands are not effective for manual laborers. Those who are working with screwdrivers, those are these people who are working with AC machines and all, there you will have to give, or those who come with tears from gyms, in them you will have to probably give hydrocortisone acetate injection. So what is this? So these are all videos. You can see the videos and you can give, you tell the patient, get TheraBands, and then you teach them, or you give it to the physiotherapist, no problem. So with straight, he has to pull it straight without flexing the elbow. This is effective even for these computer operators who are getting pain in the trapezius and the rhomboids. For them also it is effective, but basically it is to stretch with elbow straight. The second exercise which I give with the TheraBand is biceps. So that also is holding the elbow so well that the extensor carpi radialis brevis is getting strengthened. And the last exercise is flexion of the wrist. This what was unfortunately of mine was for 35 years, expired in COVID. Very unfortunate for me. So I have saved this video for my lifetime. Yeah. So elbow, and now forearm. You do this and the patient has to leave without pain of tennis elbow, and that is a promise. Yeah. So this is once again this. Okay. Sorry. So yeah. So she'll do the same thing. I'll show 2-3 videos so it will get into your minds. Same. This is not for trapezius tendinitis and rhomboid tendons, which these operators, they keep on doing this, that. The entire trapezius and the rhomboids are weak. Next slide. This man is there, audio visual. Okay, yeah. The same slide which the what boy was doing. This is good for tennis elbow. It is also good for trapezius tendinitis. Don't give any injection or rhomboid tendinitis of computer operators. Elbow straight. Actually, the person should be here who will operate next. Forearm. I just wait here only. Yeah, forearm. The elbow should not flex. Yeah, and this is the last exercise, overhead going behind. Also good for, once again, trapezius tendinitis and rhomboid tendinitis of computer operators, but also good for tennis elbow. Going back, elbow straight, both in the front and overhead, elbow straight. Then you had the biceps and then you had the forearm. TheraBands available in all sports shops. You don't take the TheraBands which are pink, you don't take which are yellow, you don't take which are green. They are very thin and they are not effective. Take the ones which are violet. Okay. So same, this lady will show. Yeah. Once again the same thing. All these people had come with frozen shoulder with their kind permission and masking the face. I have taken that. One of that was a physiotherapist. Yeah. Just to, so that you will get it into the mind what is to be done with TheraBands for tennis elbow and for rotator cuff tendinosis and for rhomboid tendinosis. So I get almost 95%. Why 95% good outcomes? Because as I told you that manual laborers, those who work in air conditioners, those who are carpenters, obviously they are working that, so it's not effective, so you'll have to give a steroid. I have not referred patients to physiotherapists, but I have faith in them. I have nothing against them. I have not used steroid injections for years for tennis elbow, rotator cuff tendinosis and for rhomboid tendinosis. Steroids only in manual workers. Try it. It's going to work. Try my method. Thank you so much.